And the state now one step closer to banning gender-affirming care for minors.
The Senate voted to pass the bill today. It bans surgeries and other procedures for children under 18 years old. Now it heads to a House committee.
News 4's Capitol Bureau Chief Nick Camper was there for today's vote. Nick?
Yeah, Senate Democrats pleaded their case one last time to prevent a ban on gender-affirming care for minors. They say that this is a private decision between the children, the parents, and their doctors, whereas Republicans argue it's a decision that should wait until the child is 18.
Oklahomans need to take a stand. Children cannot make these adult decisions.
Passing through the Senate with a 40-8 vote, a ban on gender-affirming care for minors is one step closer to the governor's desk.
They can choose what to do with their bodies when they're an adult, but we need to protect them in the meantime.
The ban would make it illegal for doctors to perform surgeries or prescribe hormone drugs or puberty blockers for purposes of transitioning. Republicans say parents shouldn't be forced into treatment they are uncomfortable with.
We have to do a better job on mental health. But you cannot cure confusion with a knife.
The ACLU of Oklahoma argues no one is being forced into treatment they don't agree with. The organization also pledged to sue the state if gender-affirming care gets banned. The executive director emphasized their position Wednesday, saying, "Gender-affirming care is life-saving care, and the ACLU of Oklahoma and our partners are determined to fight these baseless laws at the Capitol or in the courts."
You may not agree with the medical decision, and that's fine. That's not the point. The point is the parent still has that right, or should have that right.
Democrats argue these decisions are made in private by children, their parents, and their doctors, with parents having the final say.
If we are at a point in this legislature where we are going to start picking and choosing what medical procedures that we allow, irrespective of what the parents want, then we are on a very slippery slope.
Now, in the past, we have spoke to physicians that have trans youth patients, and they say that mental health services are the first steps for families in order to find out the best outcomes for their children. The physicians also say that there are no surgeries for minors happening in Oklahoma. Reporting outside the Capitol, Nick Camper, Oklahoma's News 4.
All right.